My name is Kimberly Lesperance, and this is my head-to-toe assessment for our health assessment class. My patient today is Gloria Lesperance. She is my mother. She is 66 years old. She is quite healthy for her age. Her general appearance is, overall her general appearance is okay. There's no deformities noted right away, no abrasions or wounds that I can see right off the bat. I do see just some slight fine wrinkles to her brow. Her face is symmetrical, her ears are in line with her eyes. Her nose does have a slight deviation to the right. There is a scar noted to the right side of her neck where she had a cervical discectomy with fusion back in 2007. On her skin assessment, she's noted to have freckling with some moles. Her skin is not dry and it's not overly moist. She has good skin turgor. She has less than 3-second capillary refill. She does have some little nodules on her knuckles, and I believe it's from arthritis. You have arthritis? But her skin temp is the same on each side. So now I'm going to get to starting the actual, I'm going to start with her head. So the first thing I'm going to look at is her hair, to make sure there's no, I'm going to check for the hair distribution, make sure there's no patches of hair being missing, checking for the texture and it's the same everywhere. Now I'm going to actually go in and palpate her head, just to palpate the skull to see if I feel any nodules, any deformities or masses. And there are natural depressions in the skull. You have the occipital, the temporal. And while I'm doing this, I'm going to go ahead and feel for her lymph nodes. So I'm going to start here at the preauricles, and I can actually feel those. Do you have any pain there?
No.
Okay. So now I'm going to go back to the back, and I'm just going in like a circular motion, kind of running my fingers around to see if I feel any. And I don't feel any tenderness.
No.
Kind of lean forward and hunch your shoulders, trying to feel the lymph nodes in here, and there's none felt. So now I'm going to go ahead and move on and get her vital signs so I can get a baseline. And I will say before the video started, the patient's height and weight were both obtained along with her temperature, which the temperature was within normal limits, and her height and weight, the BMI has been figured out, which will be in my report. No, just, there you go. Her blood pressure is 108/58. I'm going to go ahead and check her pulse. And she does have a strong pulse. Seems we have an interrupter. Oh, damn. So her pulse was 76, and like I said, it was strong. And I'm going to go ahead and feel her pulse in both so I can, and they both feel strong. While I was counting her pulse, which I counted for 15 seconds, I also counted her respirations for 30 seconds, and her respirations are 18. And they're non-labored. I don't see any accessory muscles being used, and she's not breathing with her stomach, so that's all normal. Now we're going to go ahead and check her vision with the Snellen chart, which I have down the hall right here, so I'm just going to have the patient step off to the side. And, yep. We have a marker set on the floor that's 20 feet away. So I'm going to have you go ahead and cover your eye. She's covering her right eye first. And I want you to read the line the smallest line that you can read.
D-E-F-P-O-T-E-C.
Okay, read the next line down.
L-E-F-O-D-P-C-T.
And the next line down.
F-D-P-L. I can't.
Okay, so her vision in her left eye is 1320 with glasses on. So now I want you to uncover your right eye, and nope, let your eyes come back to focus for a minute. And then when you're ready, you can go ahead and cover your left eye. And begin.
F-E-L-O-P-E-D. No, Z-D.
Okay, read the next line down.
Hold on. D-E-F-P-O-T-E-C.
Okay, and read one more line down.
L-E-T-O-P-I.
Okay, so in her right eye, she is 20/20. You can come back and sit down, and I'll help you up here. Okay. Are you comfortable?
Yes.
Now I'm going to go ahead and conduct her eye exam, so if I can get you to hold on to those. So right now I'm just observing her eyes, and like I said, they are symmetrical. Her eyes are nice and white. I'm checking for edema. I'm also checking the hair distribution on her eyebrows, and it's the same on each side. She does have some slight drooping of the eyelids, not drooping of the eyebrow, but it's not blocking her vision. So now I'm going to get my ophthalmoscope and check her optic disc. I'm going to make sure that her optic disc is like a yellowish orange color. I'm going to check for her arteries and veins in there to make sure they go in all 4 quadrants, and I should see that as the vein and artery exceeds into the periphery that it gets smaller. I'm also going to see if her macula is also near her optic disc, and it should be a dark color. So and I'm going to need the lights off for this. Okay. So now I'm going to turn this so that I can see inside real good. Okay. Now I'm going to do her other eye. Okay. Everything noted to be within normal limits. So now we've completed, let me turn the lights back on. You can put your glasses back on if you like. So now I've completed the portion of the vision test, actually looking into her eyes, checking her optic disc, and now I'm going to move on to her ears. So we're going to go ahead and do the whisper test. So if you would just cover that ear, and I'm going to go behind her and whisper 3 letters or numbers, and I'm within 1 to 2 feet of her. A, B, O.
A, B, O.
Okay, and I'll repeat it one more time. C, R, P.
C, R, P.
Okay, so she got a total of 5 out of 6 correct. So now I need you to cover this ear. Oh, I need you to cover that ear. Okay. P-L-T.
P-L-T.
O-3-I.
O-3-I.
Okay, so she got a 6 out of a 6 in her right ear and 5 out of 6 in her left ear. So now we're going to do the Weber and Rhine test. So what I'm going to do, I'm going to set this on top of your head like this, no pain, and you're going to tell me which ear you hear it in.
Right. Both.
Okay. Let me do it one more time. I don't think I had it midline.
Both.
And now I'm going to check the air conduction and bone conduction. So you're going to tell me when you hear it and when it stops. Okay? Just kind of turn your head that way for me a little bit. There you go.
Here. Here.
Did it stop?
Yeah.
A long time ago?
Well,
You got to tell me when it stops. You ready?
but I kept hearing.
You did keep hearing it? Okay,
Yeah.
well, let's do it one more time. Turn your face a little bit. Do you hear it? Okay. Tell me when it stops.
Okay. Stopped.
Now tell me when you hear this and when it stops. Do you hear it?
Mm-hmm. Okay.
Okay. Now I'm going to go ahead and do the opposite ear. And it does say that the air conduction should be twice as long as the bone conduction, which hers was. So now we're going to go to the left ear. Same thing over here. Do you hear it?
Mm-hmm. No.
Okay. Do you hear it?
Yes. No.
Okay. Okay, since we've now done her hearing test at her ears, now we're actually going to inspect the outside of her ear. So I'm just going to feel around each ear, just checking for any lumps, masses, nodules, anything. Do you have any pain
No.
when I'm feeling? Okay, so everything looks normal. So now I'm going to actually take an inspection inside to see her tympanic membrane. And again, I think I'm going to dim the lights because it just makes it easier for me to see. Okay, so I'm going to go ahead and check her left ear first. And on an adult, you want to pull up and back and upside down. Okay, so her tympanic membrane is a pretty like pearl bluish color, and it's intact, and I don't see any redness or swelling inside of her ear, and I don't even see any cerumen or wax buildup. She does have some cilia that are clean, so that ear looks good. Now I'm going to check her right ear. Okay, again, a bluish gray, like pearl color is noted to her tympanic membrane. She does have some redness in this ear, close to the eardrum. But other than that, no wax buildup. She still has cilia intact. Do you have any pain in your ear?
Mm-mm.
Have you had any drainage with
Yes.
sinuses?
Yeah,
Okay.
started this morning.
So that's probably what I'm seeing. So now let me go ahead and turn the light back on. Can you help her?
These are messed up.
Okay. Now I'm going to move on to asking the patients a series of questions to observe their level of consciousness. Can you state your name,
Gloria Lesperance,
your date of birth,
1/21/49,
and where are you right now,
at home,
and what city?
Kathleen, Georgia,
Okay. And who's the president,
Obama,
and what year is it,
2015,
and what are we doing right now?
an evaluation.
Okay, so the patient is awake, alert, oriented to person, place, time, and situation. And while I'm asking her the questions and she's answering me back, I'm also noting her speech. If there's any abnormalities with her speech, like hoarseness or maybe murmuring, or not murmuring, mumbling, just her type of speech, her pitch, her tone, and she, as you can see, is easy to hear, very clear when she speaks. Okay, so now we're going to get to I'm going to check her mouth now. So my initial assessment, I'm just going to have her smile and show me her teeth. Kind of lift your gum up a little bit. Okay. And do you wear dentures?
No.
Okay, so those are all your teeth?
Yes.
Okay. So now I'm going to go ahead and check her oral mucosa, her buccal mucosa. I'm going to check her uvula. He's not on camera. And I'm going to go ahead and do that with this. I've got my tongue blade, got my little light, although I could use a pen light. I think this one's better. Open? Yeah, this one's better. Okay, so right now I'm just checking her buccal mucosa. It's nice and pink and moist. I don't see any. No, close. Open a little bit. I want to see your gums. Okay, so now I'm just looking at her gums up here. Okay, I'm going to check down here, so just kind of relax. And then put your tongue out. Okay. And move it to the side. Good, move it to the other side. So right now I'm just checking for those little canker sores on the sides of her mouth, or on the sides of her tongue. And now I need to see under your tongue. Just making sure everything's intact. It looks good. Okay, now I'm going to check her uvula, her tonsils. Have you had a tonsillectomy?
No.
Okay, so she still has some. Okay. So stick your tongue out. Say ah. Her uvula moves up when she says ah. And now I'm looking at her tonsils, which it looks like she does have a pus pocket on her left tonsil. Are you going to gag? Okay. And now her right tonsil looks okay. Check her gag reflex. You don't want to tell them about that before you do it. Okay. And okay. So now I've done a total head assessment, minus the sensory. So now I'm going to have her do that. I need you to close your eyes, and you need to tell me what you smell, okay?
Alcohol.
Okay. Now close your nostril, one of your nostrils. Tell me what you smell.
Still smells like alcohol.
Okay. Close your other nostril.
Alcohol.
Okay. So she does have smell on both sides of her nose. So now what I want you to do is close one of your nostrils and breathe in and out. Okay, now close the other nostril. Okay, so she does have the deviation to the right, and when she's taking a breath in and out of that right nostril, you can definitely tell that there's a smaller space for her to be able to breathe. And I was checking her smell sensory. So now I'm going to check her facial senses. So I want you to close your eyes, and I'm just going to feel around your face, and you tell me if you feel something soft or something sharp.
Soft. Sharp. Soft. 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 Sharp.
Okay.
Messed that up.
It's okay, it's whatever you feel. So now we need to take a look inside of her nose.
Feel like a blow.
No. So when I'm looking inside of her nasal cavity, I'm looking for, again, any redness, swelling, any lesions, masses, nodules, polyps. So I'm going to go ahead and look inside your nose. So if you would just kind of look up at the ceiling for me and kind of lean forward because you're tall. Okay. I'm going to turn the light off.
Do you need to step on that?
No. Okay, she does have redness. Redness at the septum. No drainage noted that's coming out. No, she still has hair. Now I'm going to look at the other one. And this is definitely reddened too. But no polyps or anything noted. Just getting closer. Okay, so done with this stuff. Okay. Now we're going to go ahead and move down to her respiratory system. Again, we've already done the head assessment. We've done some of the skin assessment, her upper body. We've done her eyes, nose, mouth, and when I was inspecting her mouth, she does not have any missing teeth. There are several fillings noted. And before, when I counted her respirations, I noted that her breasts were unlabored, her chest was rising equally, and that she wasn't having to use any accessory muscles to be able to breathe. Do you have any shortness of breath currently?
No.
Okay. And before I move on to that, there's one thing that I forgot to do. Can you please take off your glasses? So right now I'm checking for Pearl, which is pupils equally reactive, equally round and reactive to light. So I need to do that now. I'm going to turn the light off again. Okay, so I need you just to look at my nose. Okay. So now I'm checking for direct pupil response, and now I'm going to check for accommodation on the other side. Okay. And now I'm doing direct in this eye. Good. And now accommodation. Good. And her pupil size is, it looks to be about 4 millimeters in each eye. So one's not bigger than the other. Now I'm going to check for the 6 cardinal positions. So I want you to follow my finger. Just do not move your head. Just move your eyes. Okay. And her eyes move equally together. And now look at my finger again. Okay. I'm just again checking another movement of her eyes to make sure that they move together in unison, and they do. Now we can move on to respiratory. So I'm going to get behind the patient. And she does have a robe on that has an open back, so I'm able to auscultate directly on her skin. So the first thing I'm going to do, I think the doorbell's ringing.